Hi, everybody. Good evening. Welcome to Evoke Therapy Program's broadcast. I'm Dr. Brad Reedy. Today is Tuesday, April 2nd, 2024. For those of you that might be new to the live broadcast, every other episode we host a live broadcast. You can always send in questions, suggestions, prompts to webinar@evoketherapy.com. Those questions go to the top of the queue, and then any of the live participant, any of the live audience that want to submit questions throughout the broadcast can submit those. Michelle, who's moderating for me this evening, then she will pass those on to me in the order that they're received. So you're welcome to do that. Before I get into the pre-submitted questions, of which we have two this evening, I just want to talk about one thing, both clinically and also practically. I want to talk about our Finding You program. Finding You is a 4.5-day therapeutic intensive, all included, right outside of Park City, Utah. We pick you up at the airport, we drop you off at the end, and it is an opportunity to go and do your own work. This is not psychoeducation, although, of course, there are skills and tools that are talked about, but this is really a deep dive into your own work. So if you're wondering what is your work and where to start and what to say to a therapist, if you go, Finding You is a great springboard into your work. If you've been in therapy for a while, like I had been at the time that I attended my first intensive as a participant, it can really be an accelerator. This is something I did after having a PhD, after being in practice for more than a decade. I went to my own therapeutic intensive, and I thought it's so profoundly moving for me that that was the inspiration behind starting our own intensive program. And let me just say this for those of you that are parents, because so many parents listen to these broadcasts. I want to be clear that, in my opinion, there's no more important work that you can do than your own work in something like a Finding You. To come and understand your own childhood, to go back and understand the context that you grew up in, and to understand how that context is still driving behaviors, really contributing to dynamics today, to me, is one of the most important things that you can do. And the research bears that out. The research suggests that parents who want to provide children with a secure attachment, which is the most important thing we can do for our children, parents that want to do that are best served by doing their own individual work. So Finding You, our next available one is April 10th. There's a spot left in that, I believe. May 1st after that. We also have an online version of it, which is about half the time and a third of the cost, and you don't have to travel. May 17th through 19th is that offering. It's over a weekend. Of course, we have custom programs for individuals, couples, families, and co-parents. Contact contact intensives at evoketherapy.com for more information. All right, let's get into the first question. The first pre-submitted question reads, but isn't there still something to be said about respecting your parents? Spending time with your parents for the holidays is also showing you care and don't want your parents to be alone. Like, why would any kid want to make their parents sad? Doesn't that seem selfish? This question came in the context of the last broadcast where I was talking about how it's not a child's job to take care of their parents. And I told a story about my own children who were going to spend time with their mother, had announced to me they were going to spend time with their mother, my ex-wife, during the holidays, and that I wasn't going to get some time with them. And how when I expressed some sadness in that, they immediately wanted to take care of me and make sure that I was going to be okay. So let me explain to you. First of all, there's nothing wrong with wanting your parents to be happy. There's nothing wrong with um, doing acts of service for people that we care about and love. But the fundamental idea that I was trying to illustrate is it's not the child's job to take care of the parents. And even when children grow to adulthood, especially young adulthood, in the case, in the situation that I was sharing with you, um, the child is really incapable of separating out their own needs, taking care of themselves. They will likely give up important aspects of themselves to other people, to their parents, to maintain the connection or the proximity. And then what happens is they go out in later relationships, um, and they have the experience of the same kind of experience. They have the experience of not knowing who they are, not knowing where their boundaries are, not knowing how to take care of themselves. So it becomes a pattern in our early context in childhood, and that gets repeated. The real challenge is, and I've had this question asked to me in 1,000 different ways by 10,000 different people. Um, the question becomes, when are you being too rigid and selfish, and when are you being too much of a doormat and giving up too much of yourself in the process? And the interesting answer that I give is that's right. That's the right question. You have to figure that out. That is the question of who are you? That is the project of finding you. And you get to decide that, and nobody else gets to decide if you're being selfish or you're being right or wrong. In fact, I know I talk about this a lot, but it's so fundamental, and it always comes back to this, that we have to have success with overcoming guilt and shame in our lives to become who we are, to be our highest and our best self, to give the most love in the world that we can give. So we talk about this when we're doing supervision and when I'm teaching therapists, that when a new client comes to you and says, presents their dilemma or their problem, what should one do about that? The funny thing, I think, and I'm reflecting on my own therapy, is if I were just laying it out before them, I would say, well, fundamentally, you've accepted the wrong answers for life's most important questions, and virtually everything you've been taught about love, fear, relationships, nurturing, connection, intimacy, and boundaries is wrong. It's backwards. And that might sound so ridiculous in the way that I just said it, but it is that profound. So much of the time, what we were taught were the solutions to life to protect us from pain actually become the mental illness itself. So no, it's not selfish. And it's really about self-care. It's about taking care of yourself. And as a father, and I can speak for my wife also as a mother, um, we don't think of it as our children's responsibility to take care of us even as we age. We don't rely on them for our emotional needs. If we become incapacitated someday, we hope that our children will make sure that we're healthy and safe. But aside from that, short and we try to make plans so that they don't have to give up their lives to do that also. That's part of our investing in our financial future, and I won't get distracted by that. But the idea is, in a family, the relationship between parents and child is kind of one way, but most of us weren't taught that. Most of us were taught that it is good to sacrifice who you are. And my answer, it's not good or bad. It's just something to look at and be conscious of. And I will tell you that most problems, not just in life, but even in intimacy and connection, are related to this problem of self-sacrifice and resentment and expectation for reciprocity and guilt and shame and manipulation and all of the things that I talk about all of the time. So yes, on the surface, your question, there's no there's no problem in a child wanting a parent to be happy or a child wanting a parent not to feel lonely around the holidays. But the illustration, the point I was making is that's not their primary job. It's our job to take care of them. It is not their job to take care of us. It doesn't work that way. It actually impedes child development. It causes great strain on the child's psyche. We occupy something, a different a different place, a different size in their psyche than they occupy in ours. Our job is to be the adult. Our job is to take care of ourselves. Our job is fundamentally a giving job to the child. And to do that, by the way, to do that, we have to deal with our guilt so that we can take care of ourselves. We have to be able to say no to our children, or I can't, or I'm not able to, or I'm not willing. And what gets in the way of all of those important sentences that a parent might say to a children, it is the idea that you ask about in your question, that was embedded in your question, that behavior is selfish. And that is what's going to stop you from becoming healthier. Remember this. I'll kind of conclude on this idea. Getting healthier for virtually everybody, getting healthier will cause you to feel shame, and even more probably commonly, will cause you to feel guilt. It will not feel good. It will feel scary. It will trigger your abandonment wound. You'll think that people aren't going to love you. You'll think that you have no worth. So all of the things that we've been taught that give us worth and value are the things that are going to get in the way of us taking care of ourselves. And at the end of the day, the great paradox at the end of the day is that if you can learn to take care of yourself first, if you can secure your own mask first, like they instruct you during the instructions when you get on a plane, if you can learn to take care of yourself, nothing will be left but love. And if you don't learn to take care of yourself, you will constantly be asking and taking from the people that you care about. So, great question, something I almost expect people to ask, and I love to answer it. All right. I have a three-part question. Somebody writes this. Somebody writes in and says, I'm trying to utilize insurance for treatment for my 15-year-old. And knowing what I've learned from Brad, I have this feeling that the places don't provide deep healing that I want for my daughter. I've traveled pretty far to admit my daughter to a place that a hospital recommended and that insurance covered. Go ahead and drop the other two, Michelle. I had heard from my people that this place is great, yes, yet my educational consultant could not endorse it. And basically, that said it was a hit or miss. Upon getting there, after a long and arduous, impossible trip, we got there on Friday, I wasn't given prior information about the admission process or what would be happening. It was a rainy, gloomy day. On top of my own fears, my daughter was willing, but truly not wanting to be there. She was scared about being away from home, and had heard bad things about this place from her peers. The nurse that received us was new and didn't seem to be secure. The aide had no clinical experience. I had questions because I was not feeling safe, and the answers we received made me feel ambivalent about whether this was a safe place. When I asked to speak with someone more experienced, no one was available. I went into fight or flight, but did not realize that until the next day. I assume my daughter did as well because she tried to run off. It was a mess. I learned my daughter's therapist was an associate, which was a non-negotiable, that she worked with a licensed therapist, which I forgot to express prior. I learned that the clinical director had her license for 1 year. It was a mess, and my daughter was not admitted. When I expressed my concerns, their defenses came up, and on top of that, my family withdrew emotional and financial support because of this. My dilemma is that I can't handle my own anxiety about putting my daughter into treatment. I don't trust the places that my insurance will cover, and my daughter doesn't want to go to treatment, and the only place I trust right now is Evoke. I'm not able to go with transport because of my own trauma and anxiety, and I'm still afraid to send my daughter to Wilderness. I need to tell her about it first. How can I talk to my daughter about Wilderness? She is not safe at home. My heart breaks for you. Thank you for asking that question and giving us all the context, because there's a couple of points here. Number one, insurance-based programs are important. And lately, that's the trend, is that insurance-based programs are often suggested alongside of Evoke therapy programs, which is not an insurance-based program, but it's very expensive. And so it's very attractive, but your experience is more common than not. And even if your daughter had admitted to the program, there's a very good chance that even though it might have been a 30 or a 60 or a 90-day program, my experience, even in the most acute cases, is that insurance funding will go away after 2 or 3 weeks at the most. Very rarely will it even cover 30 days. And like you said, the fact that it's insurance-based doesn't necessarily set the bar that you're going to get the highest quality. So the things that you're talking about with associate therapists and with clinical directors that are fairly inexperienced are very different than the Evoke process. Frankly, I like your gut and I like your instinct, and I like that you were able to walk away based on what you've shared with us. In terms of the overall process of getting your daughter to Evoke or using transport services, folks, I really don't give advice. And I don't avoid giving advice because it's some sort of technique. I don't avoid advice to save my own butt or to avoid liability or anything like that, or to be clever. I don't give advice because I think it's wrong to give advice. You as a parent ultimately have the responsibility of parenting. Now, what I would hope that you can find is a consultant that you can be anxious with. That even as you talk to our admissions folks, that you're allowed to be anxious and second guess and third guess and so on and so forth. That ultimately you find a therapist to help you work on your trauma. Like you said, you're avoiding some of this process or reluctant to do some of this process because of your own trauma response. That's important. And just like I started off this broadcast, I believe you doing your work in the long run is even more important for your daughter's progress than the treatment process. I don't know that for sure. If she's at immediate risk, I mean, if it comes down to the point that your daughter's life is at immediate risk, then I would encourage you to find somebody to hold on to tightly and just to do it afraid, because there's no coming back from something that's life threatening, right? That's game over. You don't want to get up against that. So find somebody to support you. Find a coach that can talk you through it. And this goes for all of you. I can't emphasize this enough. If you're anxious, if you're not sure of yourself, if you find yourself second guessing and overthinking things, my response as a therapist and a clinician is, I understand. Virtually all of the wounds and issues and neuroses that my clients have, I have to some extent. Some more than others, for sure, but I can relate to it. And what you deserve, what I know you deserve, is you deserve patience and love. And you deserve somebody that can empathize with you. And if the professionals around you are getting frustrated or unwilling to respond to your questions, move on to another professional until you find somebody who has the compassion, has the experience, and has done the personal work that can show up to your dilemma with compassion and understanding. I recently, in a couple of different talks that I gave to the field that I work in, to professionals, to consultants, to therapists who run and work at programs, I've said the same thing to them that I've said to all you today, which is do your work. I tell professionals all the time, if you believe the fantasy that you're different from your clients, you are doing them, yourself, and your family a great disservice. The fact of the matter is we're all in this together. Some of us might be a little bit farther along because of the time we've spent on the path of healing, but we're on the path of healing, the same path that you're on. So I would hope that professionals do their work and understand, because in my experience, the deepest work, the important work shows me that you can only bring clients as far as you've come yourself. And what that means is that you should be able to relate to their issues because you've had to cross those thresholds yourself. And if you haven't, find someone who has and learn and listen and listen and listen more. So I'm sorry. At the end of the day, it's going to be a scary decision no matter what. It's your responsibility. If the situation is life threatening, find somebody that you trust, hold on to them, and ask them to help you walk through the process. But short of life threatening, work on yourself. Do your healing. I whenever I talk to somebody who's inquiring about any of our programs, when I talk to a parent, I always say to them, I'm not so committed and focused on you enrolling your child to our program or coming to finding you. The work is the same. The specific situation, the challenges, the issues that you're having with your child, with your marriage, whatever, with your co-parent, whatever it is, those issues are going to need to be worked on by you one way or the other. So work on yourself. Listen to the podcasts. Find a coach or a therapist. If you don't have a therapist and you're willing to work virtually, work with one of our Evoke coaches. Not even in the spirit of getting to this final decision, but in the spirit of healing the stuff that's getting in the way of this, and I'm sure, I'm convinced, many other issues, many other challenges in your life. So when I talk to somebody that's inquiring, I never do a hard sell. And that's not me doing a podcast, by the way. That's me talking to somebody who's called about our program, considering enrollment. I don't do a hard sell. And I tell them the work is the same either way. And in many cases, I believe that enrolling your child in a program like ours is just evidence of the fact that you've developed some sort of secure foundation where you can make that absolutely difficult and terrifying decision that has no guarantees to it. So my heart goes out to you. Somebody writes in tonight from the live audience. My older brother and his wife are invited to many gatherings, but they do not come. His wife, we believe, wants to come, but I think my brother has some anxiety with his family or something. Is it helpful to keep inviting him to gatherings, or is it more stressful to him and his wife, who has to come up with excuses? Is it helpful to let our sister-in-law know that we don't want to stress anyone out, but that we don't want to stop inviting or not, if that would be helpful? Wonderful question. Great question. I think what I would say is just name it in an email, in a text, in a voicemail to your sister-in-law and or your brother. Say, we want to keep inviting you, but it's okay if you don't come. But we want to know that you're welcome and you would be wanted in this program. Excuse me, in this event, this dinner, this celebration. And I would say something along the lines, I assume if you're not coming, you must have a good reason. And I support you because whatever the anxiety about showing up is, I'm sure if that's what it is, I'm sure that plays into his refusing to come or not showing up. So I would just name it and give him permission and tell them that you can take care of yourself and that you're fine, but that you're not going to stop inviting unless they don't want to invite, that you assume that his reluctance to come is based on something that's important to him. That's that's the most loving, healing thing you can do. It reminds me of the quote by the Buddhist monk Thich Nhat Hanh that says we should love others in such a way that they feel free. And that's the spirit of what I'm suggesting you might say to your brother and your sister-in-law. Wonderful question. Somebody writes, what do you mean by insurance-based programs? I mean programs that market themselves as insurance paid. At Evoke, you can get some reimbursement for some things. We can provide you a super bill, but no insurance company has a contract with us. Nobody is saying they're going to pay for 30, 60, or 90 days of our program. It's not on the front end suggested that insurance is going to pay for it. And oftentimes, after the insurance runs out, in these programs that market themselves as insurance based, you're going to have a very, very high daily rate. We get a lot of clients who are blowing out of what I'm calling insurance-based program or programs that market themselves as paid for in full by insurance. That's what I mean by that. Somebody says, "Hi, Brad. Would you recommend your upcoming attachment theory class for a non-therapist such as myself? My gut is that it will help me grow personally. I'm also potentially interested in pursuing coaching, so I believe your course will be valuable. Can you talk a little bit more about it?" Yes, I can. Thank you for asking. So the course that this person is asking about is on May 24th. It's an attachment-based it's a masterclass on attachment-based therapy, specifically navigating resistance, transference, and countertransference that I will be running from 9:30 a.m. Mountain to 4:30 p.m. 4:30 p.m. Mountain. It's $250 for the full day, and it's worth 6 continuing education credits. You can come if you want to. Anybody can come. It is going to be geared toward people that work in the mental health field. But if you're somebody who reads a lot, who likes to understand what the method is about, absolutely. I mean, you know, most of my education, and this kind of shows you how the blend works, most of my education comes from being a participant in psychotherapy, not from school. On top of being a participant in therapy, in my career, I've read lots of books to augment that information. But I've learned more about being in therapy, about being a psychotherapist than I learned in school by a long shot, by a significant amount. That is why I place so little value on the practice of therapists who don't do their own work, because you learn more in therapy than you do in school. That is just, I don't even know if I've ever known anybody who feels differently about that, who's attended long-term therapy and gone to school for it. So yeah, I don't think the issues will be too far out of your league or too complex or too academic. I think for most people, I'm talking to therapists who probably have very little experience with this. See, there's this idea that there's this idea that countertransference, transference, psychodynamic theory is outdated. That it's the old-fashioned therapy, psychoanalysis or psychoanalytic theory, and that whatever's hot and new today, like DBT or brain spotting or EMDR or somatic therapy, whatever it is, that's the hot new, usually American thing that can do the same job in a short period of time. While I value all of those approaches and what they have to offer to the field of psychology, the kind of therapy that I'm talking about is the fundamental relationship between the psychotherapist and the client. When I teach this, I'm going to explain this. When I teach about psychotherapy, I explain to the therapist that you are the medicine. How you feel, how you think, the way you are with somebody is the medicine, is the thing that heals them, that repairs their attachment trauma, that addresses the small t wounding. I've written about this recently. In fact, I was just reviewing this moments before because I was studying something else. I was reading this post that I made a long time ago where this is what I wrote. Many voices have accurately identified trauma as a source, an underlying cause of mental illness and its symptoms. However, this is not a new idea. The idea that trauma is at the root of things goes back to Freud and was at the core of the invention of psychotherapy or analysis. Thankfully, recent voices like Gabor Mate, Bessel van der Kolk, and Daniel Siegel, the list is long, are reaching the broader public with the notion that trauma is the primary issue. So what's missing from this discussion? It's the understanding of the method, the healing process that heals trauma. While people have identified trauma as the culprit, few, since the beginning, have identified the process by which a person heals. The psychoanalysts talk about it all the time. I call it a method, but it is really a sensibility, a way of being with somebody. It is attachment-based therapy, and it is beyond simply understanding how trauma was created and how it is repaired. The process that I'll be talking about, the process is to expose oneself repeatedly over a substantial period of time to a compassionate, patient, non-judgmental therapist or other healer so that the attachment wound can be repaired. This therapist, this person must be fundamentally different than those in the client's earlier contexts. This method doesn't rely on saying something to somebody like, it's your unexpressed anger that led to your disorder, your disease, but rather rests on the experience of sitting across from an understanding therapist, less interested in fixing the client and their symptoms, and more interested in understanding and attuning to the client's story. When you go to a doctor for a broken bone, they don't simply tell you what happened, they apply a healing method to repair the damage. So, no matter what you practice, no matter even if you are inclined towards some of those theories that I mentioned that are more modern, still how you feel and think and treat the client, even unconsciously. And I'll give you one example um, of all of this. The one example that I give you is that um, the most common countertransference error. Countertransference error would be the feelings that the therapist have toward the client. The most common error that somebody makes from some feeling, some countertransference feeling, is the eagerness to help fix the client, or the eagerness even to be of value as a therapist. When the therapist is eager to be of value, the client will feel that anxiety and be inclined to want to take care of the therapist. You don't owe your therapist anything after you've paid the fee for their time. You don't owe them anything. Especially, you don't owe them your progress. I don't need my clients to get better, to improve, and paradoxically, not needing them to get better or improve is the energy that helps them to get better and improve. But if I am in a hurry, if I want to be seen as a good therapist, if I want to be seen as helpful and valuable, I'm really taking care of my needs in that session. And in very, very simple ways, I'm most likely going to replicate the wounds that they had in their family, where their parents needed to be taken care of. But if I do my own work, if I understand the project of psychotherapy correctly, and I make sure to take care of myself so that the client doesn't have to, I position myself in such a way to give the client an experience that they've never had with another adult. And that's what I'm going to be talking about and teaching. Somebody writes and says, "Hi, Brad. My daughter believes that she is already bad because she has been sent to wilderness therapeutic treatment and said, what's the point of trying to be good as she has damaged goods? What's your advice?" She's at Evoke right now. You know, I I don't think the problem is that she's been sent to treatment. There's a fundamental idea in her thinking that is the problem. The fact that she's been sent to treatment and therefore she makes the equation that she's damaged good. That's just the event. It's the same thing as if a girlfriend or a boyfriend would break up with her, or she would get a D in a test, or she would get in trouble in some other way, right? Something in her life is going to trigger that. So what you're telling me about is your daughter's mental issues, mental health issues, her self-esteem, her idea of her sense of self. And the fact of the matter is, in psychotherapy, if psychotherapy goes well, I'm going to say something kind of, I think it's kind of fun, but it can sound really dramatic. If psychotherapy goes well, the client will realize that they are a miracle, a beautiful, beautiful miracle, and that they are a disaster, just like everybody else. And it won't come with shame and guilt. You will fail. You will screw up. You will have mental health problems. You will need treatment in your life if you are awake and noticing what's going on. You will have challenges in your marriage. Everybody who's been married for any length of time listening to me knows that marriages are hard. And sometimes one or both of you is an idiot. That's just a fact. If you don't know that, you got bigger problems. You got bigger problems than what I'm talking about. Um, so your daughter's not you th- she's telling you the issues is what's happened to her, and I'm suggesting to you that the issue is what's going on inside of her. So you're describing that her sense of self is based on her accomplishments and her goodness. Remember this quote that I often share from Carl Jung: I would rather be whole than good. What does he mean by that? I would rather be whole than good. It's the same thing that all of the enlightened people talk about. Self-esteem isn't convincing yourself that you're great. Self-esteem is realizing that you are human and that that's okay. And being human means being fallible and making mistakes and doing selfish things and silly things and stupid things. Ram Dass, the great guru, said it this way. This is one of my favorite quotes. He said, a lot of people try to counteract the I am not good enough with I am good enough. In other words, they take the opposite and they try to invest it. That still keeps the world at the level of polarities. The art is to go behind the polarities. So the act is not to go to the world of I am good to counteract I am bad, or I am lovable as opposed to I am unlovable, but to go behind it to I am. I am, I am. And I am includes the fact that I do crappy things and I do beautiful things, and I am. That includes everything, and I am. So your daughter has a self-worth, self-esteem, a narcissistic wound, probably inherited through your parenting, which was inherited through the parenting that was done to you, which was inherited through the parenting that was done with them and reinforced by the entire culture. See, what we know about psychology and psychotherapy now is that the fundamental ideas about human beings and about relationships in our culture and the dominant culture are wrong. We as a culture have accepted the wrong answers to life's most important questions. And if the goal is to be good, you are doomed. But if the goal is to be human, that's something we can do. Just to close it out, the epigraph of my book, The Audacity to Be You, Learning to Love Your Horrible, Rotten Self. In fact, I might even recommend to you that you recommend to her that she read that if she's old enough, if the therapist thinks it's okay. The epigraph in The Audacity to Be You says, why were each of us taught the notion of being correct when the very notion ensured our failure in the world? So your daughter doesn't understand what it means to be human, and she thinks the goal is to be good. And that's probably something that you accidentally taught her. I know I taught it to my children. And that's something that your parents accidentally taught it to you. And everybody did this because they thought it would help and they thought it was the right thing to do. And it's not. It's the poison, not the cure. And if you meet or listen to or read any of the enlightened people that have ever written, they will talk about what idiots they are with a sense of humor, with a kindness, with a non-shaming, with a friendly voice. They will make fun of themselves. They will laugh at themselves. They will have demonstrated their ability to overcome the shame and the judgment of being quote unquote bad so that they can just play. And then they are free to love. See, that's what all of this comes down to. The things that we've been taught about human psychology and human relationships prevent us from loving. But when you accept your and love your horrible, rotten self, when you accept the fact that you are bad and good and everything in between, nothing is left but love. The great teacher, Alan Watts, said that. Once you realize that there was nothing on the dark side to be afraid of, there's nothing left but love. But when you're clawing and scratching to be good and to be worthy of love and to be pretty enough or smart enough or talented enough or cooperative enough or successful enough, you will never find the peace that you're looking for. And like the great Alice Miller said, the one who wrote the drama The Gifted Child, my favorite, my vote for the most important book that's been written about children by anybody ever, written in 1979. She says, without psychotherapy, without therapy, it is impossible to cut the tragic link between admiration and love. That is the narcissistic wound of believing that we have to be good to be loved, to be worthy of connection, to be valuable in this world. That is what the story of Midas is talking about. The value is not in how golden you are. The value is in the connection. The value is in your humanness. And when you can learn to accept that, all you want to do is have everybody else feel it, and all you have available to give is grace and love for everybody else. So thanks for that question. It's a great question and challenging question. And she's just displaying the issues that you sent her here for. So wonderful. All right, folks. Like I mentioned earlier, the masterclass for any mental health professionals or therapists, May 24th, 9:30 a.m. to 4:30 p.m. Mountain Time, $250. I will be teaching it, and you can get 6 continuing education credits. We have Finding You intensives for individuals, April 10th through 14th. We have a spot left there. May 1st through 5th is the offering after that. And then, of course, we have the online versions, May 17th through 19th. Go to our website, use the QR code here, or email intensives@evoketherapy.com to find out more or to sign up. We have support groups for current and alumni parents of our wilderness program. April 4th, once a week. April 4th is the next offering at 7 p.m. Mountain Time. That's Thursday. Once a month, we have an alumni-only meeting for our alumni parents. April 15th at 6 p.m. Mountain Time is that offering. And then for our intensives and coaching participants and alumni, we have a support group once a month. April 8th at 6 p.m. Mountain Time is that offering. You can also email supportgroups@evoketherapy.com. Go to our website to find out more. If you're comfortable doing online virtual coaching, I encourage you to consider one of our coaches who can help you with reintegration, with codependency, with working on your attachment, with continuing the work that I talk about and teach about during these broadcasts. Email coaching@evoketherapy.com or go to our website to find out more, to be matched up with one of our more than 40 therapists and coaches. All right, folks, we encourage all participants of our program to just try 6 of any of the following 12-step support groups. Al-Anon.org. By the way, this is a free offering. These are free. We've been talking about insurance and money and how expensive all of this is. These are free. Al-Anon.org, Coda.org, FamiliesAnonymous.org, AdultChildren.org, or RefugeRecovery.org. You can also go to the National Alliance on Mental Illness, NAMI.org, to find free classes and resources in your local community. All these broadcasts are available on Spotify or your favorite podcast app. Just go to your favorite podcast app and search Finding You, an Evoke Therapy podcast. Follow there, and then you'll be notified when new episodes drop. You can also go to soundcloud.com on your computer and listen there by searching Finding You there. You can also go to Evoke's YouTube channel and watch the video rebroadcast with the slides. You can find Evoke Therapy programs and me, Dr. Brad Reedy, on X, Threads, and Instagram using the handle @EvokeTherapy and @Dr. Brad Reedy, respectively. And you can find the Evoke Intensives on Instagram using the handle @EvokeTherapy Intensives. On Facebook, you can find us by searching Evoke Therapy programs or Evoke Therapy Intensives. And of course, our blog has wonderful content each week, which, like all that I'm teaching, is written by people that aren't just teaching about what you should do, but that are really sharing about their own journey toward health and wellness. Because at Evoke, we believe that the more work that we all do and the more work that we support each other in doing, the better all of our outcomes are. in our personal lives and in our professional lives, the people that we serve. All right, folks, later this week on the 4th, that's 2 days from now, about 48 hours, I will be talking about blocked care. This was a suggestion from a listener, blocked care, regaining compassion for your child. A specific article that was written. I'm going to talk about that and talk about what happens when you just lose your compassion. You find yourself distancing from your child, and you find yourself saying, I love them, but I don't like them. Like, what is that? Where did that come from? And how can we heal that? How can we work through that process? All right, folks. Thanks for joining me. As always, if you have any questions, if you want to submit questions, if you want to request slides, you can always email us at webinar@evoketherapy.com. Thanks for joining me. I hope it's a helpful point of contact. And for and on behalf of the people that you love and the people that love you, thanks for showing up and being willing to do your work. It makes all the difference in the world. Have a great evening, and I'll talk to you next time. Bye-bye.